our party's policy with respect to P3s, and in particular regarding hospitals and healthcare centers, I think is quite clear. If you look at, what's been done just in the last 4 years. And what's important to remember on that same topic and with respect to the same message is that you can see the hospital over there on McConnell Street and the one out there in Williamstown. It's important to remember that the Conservatives voted against it. They were fundamentally opposed to it and even voted against it. In particular to the way that the Ontario Liberal government and the Ontario Liberal policy addressed, everybody okay back there, addressed the economic situation. So I think it's quite clear where the Ontario Liberal government stands. They closed hospitals. We opened hospitals. They laid off nurses. We hired nurses. Each and every one of us here has paid into the healthcare system. We want good value for our money. That's what we want.
Thank you for that question. Public-private partnerships, the stance of our government is that it's up to the local municipalities to choose where and when and the structure that they choose to build the facilities. A good example would be, I guess there was some discussion in Cornwall over the Benson Center, but that's entirely up to the community and for their choice of how they want to be built. We're not looking at enforcing, I guess, our will on the local municipalities. I guess we've seen under the Liberal Party that they've taken a lot of this planning away from local municipalities and actually for the back roads to Toronto and in the Green Energy Act, where they determined for us just what should be built in this area, 400 kilometers from Toronto. Our plan in Cornwall here was developed where we would develop a major center. Under the local government, they endorsed that and continued on with that plan. As the plan in Winchester was developed under the former government, and they continued on with it. So I guess in that format, they agree with our health plans.
The question is about private-public deals to make a service for the public, such as healthcare or for education. Actually, we Libertarians see that as an excellent stepping stone. The government has no way of finding solutions for people problems. The people have excellent means of finding solutions to government problems. And the government's starting to recognize that. So they're looking to people, private enterprise, to come up to the plate and provide solutions. Eventually, the government will step out completely. There'll be no public involvement, and private enterprises, private individuals will find a solution for all of our problems. They will create abundance for us, not misery. They will create wealth, not poverty. What we need is for free people to work in a free market, to provide free money for free solutions. Government control is being revolted by people all over the world. Government is not the solution. So this thing about the private deal is a stepping stone to back the free people.
We in the NDP feel that that is not just a waste, but an abuse of public dollars. We think that tax dollars should be used entirely for the public good. And none of it, not even 30% of the dollar, should be diverted to investors' profits. What's happened historically when P3s have been used is that the public sector tends to absorb all the loss and the private sector gains all the profit. It's an unequal system because the private and the public sectors follow different rules. They don't work well together. The private sector is dedicated to maximizing profit. The public sector is dedicated to serving the public. You can't serve the public and fatten your pocketbook at the same time. And it's not fair even asking people to try to do it. And it's certainly abuse of the taxpayer whose money gets caught in the middle.